Hello everyone, I am Dr. Hamadadar and you are watching sqadia.com. Today our topic is the ankle ligament injuries. We'll be discussing the ankle sprains. As you know, there are two types of ankle sprains, the high and the low ankle sprains. Initially we'll be discussing the low ankle sprains, that is the injury to the anterior tibio-fibula as well as calcaneofibular ligaments, which is the most common form of acute injury to the lateral ligaments, which is also usually the more common injuries which occurs in sportsmen or in different walkers, because sometimes there is always uneven surface and there's inversion injury leading to acute injury to the lateral ligaments. Then we will be discussing the recurrent lateral instability. Although acute injury is usually self-limiting and it settles down with some part of partial treatment, but usually what happens is that due to continuous trauma or due to complete tear, eventually the patient may develop recurrent lateral instability, which may need some form of operative repair or in form of reconstruction to dissolve the patient of recurrent lateral instability. Then we will be discussing the deltoid ligament tears, which are usually present on the medial side of the talus, and actually the main restraint to the valgus stress of the talus. But why we are discussing it, especially in the case of pronation, external rotation, or pronation abduction injuries, usually the maximum strain is placed on the medial side, leading to deltoid ligament tears. Although isolated deltoid ligament tears are rare, but they are always associated with the high ankle sprains, that is called the syndesmosis injury. Then we will be coming to the dislocation of peroneal tendons. Again, a relatively rare entity, but it can happen, especially if for any reasons the superior and inferior peroneal reticulum may get teared off or they degenerate over time. Or there, for example, it may be acutely traumatic as well. In case of there is a dorsiflexion, with a sudden dorsiflexion of an inverted foot, this can lead to tear in the superior and inferior peroneal retinaculum, which eventually predisposes these peroneal tendons, which is the peroneus longus and brevis, to either subluxation or complete dislocation. Then we'll be discussing this low ankle sprains as well, which is actually the syndesmotic injury. As you know, the main ligaments which form the syndesmosis around the tibia fibula and the ankle joint are anterior inferior tibiofibular, posterior inferior tibiofibular, interosseous membrane, and transverse tibiofibular ligament. Now, this could lead to damage of anterior and posterior tibiofibular ligament. Their disruption leads to injury to the syndesmosis. If you want more videos regarding orthopedics, keep watching sqadia.com. Thank you very much.